今日進行講座嘅地點位於馬斯昆、士哥米殊、塔斯里爾、沃特斯呢啲西岸原住民族傳統同埋未被割讓嘅領土上，我哋向呢啲民族致謝，讓我哋可以喺呢片土地生活。我哋今日講座嘅主題係齊來認識長新冠。我哋好高興邀請到聖保羅醫院肺科醫生及卑斯大學臨床助理教授 Dr. Alison Wong 為我哋講呢個講座。咁我哋今日亦都有我哋即時嘅粵語傳譯 Richard Wong 嘅。咁我哋而家可以歡迎 Dr. Alison Wong 同埋 Mr. Richard Wong 嘅。
Okay, excellent. Thank you for that introduction. My talk is going to be split into two sections. The first is we're going to talk about some of the outcomes related to COVID-19, and then we'll spend a portion of the talk on vaccination because I know there's a lot of questions around that.
係啦，咁今日我嘅講座咧係分兩部分啦。第一部分咧係主要講嘅呢個新冠肺炎嗰個嗰個後果啦，同埋嗰個情況啦。另外呢個第二部分咧係講係關於疫苗嗰方面嘅。咁之後咧亦都如果係亦都可以俾聽眾咧就係有啲答問時間嘅。
So we'll advance the slide.
嗱，首先我哋睇一睇嗰啲幻燈片先。
Okay, so starting with outcomes after COVID-19.
咁啊，首先開始嘅時候咧，我講一講咧，如果感染咗呢個新冠肺炎咧，有啲咩後果咧
？So COVID stands for Coronavirus Disease 2019, and this is caused by the SARS-CoV-2 virus.
咁其實呢個新冠病毒咧，呢個病咧係喺2019年係引發嘅。咁主要原因咧係由一種叫做新型嘅冠狀病毒所引致嘅。
So I was just saying that the presentation is very similar to what we would think about with the flu. And the most common reported symptoms are cough, muscle pain, and headache.
咁其實呢個嘅病咧，同我哋嘅呢個感冒啊、流感啊係好相似嘅。最主要嘅症狀咧就係譬如好似咳啦、肌肉酸痛啦或者頭痛。
Fortunately, in terms of the disease course, most people do have mild illness and they are able to recover at home.
咁就好彩呢隻病咧，大部分嘅病徵咧都係好輕微嘅。咁只要個患者咧，如果留喺屋企咧，係靜養咧，就好快就會好返㗎喇。
But a small proportion of people go on to have severe illness requiring hospitalization.
但係有一部分嘅患者咧就係好唔好彩啦，因為佢可能佢反應比較劇烈啲咧，佢有比較嚴重啲後果咧，係需要入呢個醫院嘅。
And some of the reasons for hospitalization include having a very severe pneumonia or infection of the lungs, heart problems. COVID has been associated with blood clots, inflammation throughout the body, including affecting the brain.
係啦，咁樣係包括咗佢啲比較嚴重啲嘅症狀咧，就好似好嚴重嘅一個肺炎啦，心臟有問題啦，就有啲叫血栓塞啦，或者叫所謂嘅失血管啦，咁亦都可能對呢個腦部咧有受損啦，亦都會有係一個好似嚴重啲嘅一啲發炎嘅一個反應啊。
So in the next slide, we'll see that there are some risk factors associated with having severe COVID illness.
咁我哋一陣跟住你會講一講咧，究竟有啲乜嘢危險嘅因素咧，就會引起呢啲咁嘅所謂嘅嚴重啲嘅新冠嘅肺炎。
So some of these risk factors include older age, so over 65 years old, being of male sex, having other underlying health conditions.
咁就其中就係包括咗譬如年紀方面咧，如果係65歲或者以上啦。咁亦都係如果係男士嘅啦，或者有其他本身已經有嘅健康嘅問題啦，或者係比較上咧有個免疫系統咧比較係虛弱啲嘅。
And then other risk factors include having a weakened immune system, so that could be due to other health conditions or being on medications that lowers the immune system. And then there's actually been studies that have found that reduced physical activity is a risk factor, and then being unvaccinated.
咁嗰個免疫力比較 虛弱嘅咧，就可能係本身嚟講咧，佢係呢個免疫嗰個系統係比較差啲，係可能因為係食藥嘅關係啦，又或者係有啲病啊，因為需要食藥咧，而即係減低咗佢嗰個即係呢個免疫嘅能力啦。咁亦都有證據顯示咧，就如果係即係運動咧，缺乏運動咧，亦都會有咁嘅影響嘅。咁另外咧就係咧冇打呢個疫苗啦，亦都係一個原因之一，一個風險嚟嘅。
So most people, fortunately, they will recover from COVID and return back to their previous baseline before they were infected.
咁大部分人咧都可以能夠咧就係可以復原嘅，亦都可以恢復翻去咧原本嗰個即係嗰個即係嗰能力嘅嗰個底線嘅啊。
However, for some people, their disease does not stop at that point, and actually they have persistent symptoms, and we call this long COVID.
咁但係有啲人唔好彩啦，就係因為咧佢就算係即係叫做即係過咗呢個即係染咗呢個中咗招之後咧，咁但係佢嗰個症狀咧亦都係持久啫，都係喺度嘅。咁我哋咧就叫一類咧就係叫做長嘅新冠病
So long COVID encompasses a wide range of both physical and mental health consequences.
咁呢啲長新冠咧，亦都會包括咗咧，又係一啲譬如係生理啊、心理健康嘅方面嘅影響啦、嘅後果啦。
And usually when we say persistent symptoms, this means that people are still experiencing troubles 4 weeks or longer after their initial illness.
咁我哋話佢持久性嗰個即係病徵咧，即係我嘅意思就係話咧，呢種嗰個病徵或者症狀咧，佢可以咧係喺呢個發病咗之後咧，4個禮拜咧都仲係持續有嘅。
And long COVID occurs in about 10% of people who have tested positive for COVID in the past. And it's important to note that this long COVID can be experienced by people who have had mild illness, so those recovering at home, and in people who were previously healthy.
咁就係呢個長新冠咧，亦都會係喺咧有啲即係患者咧，佢係呢個喺呢個檢測之中咧係有陽性反應嘅患者啦，有1成咧就會喺佢哋嗰度發生。另外咧，亦都會係有啲咧可能係輕微嘅毛病啦，亦都可能係之前咧係好健康嘅人士咧，佢亦都有機會咧係有呢個所謂長新冠呢樣嘢。
So in the next slide, so because COVID can affect any organ from head to toe, people who have long COVID can have a very broad range of different symptoms.
咁咧呢個新長冠咧，其實咧可以咧影響個人，由即係可以講由頭到腳，佢都會影響到嘅，係唔同嘅器官都有可能影響到嘅。
So for example, COVID can cause issues with the brain, it could cause issues with the lungs, and so people can then end up having fatigue and shortness of breath long term.
咁咧就呢個病咧影響咗嗰個人嗰個腦啦，亦都肺啦，亦都會咧嗰個患者咧就係會感覺到好攰嘅，亦都可能會有氣促嗰個情況出現。
So next slide. So fatigue and shortness of breath are the most common long COVID symptoms.
咁喺長新冠呢方面咧，佢個症狀咧最多嘅咧就係會係有呢個即係疲好攰啦，同埋係有呢個氣促嘅情況。
And the symptoms are severe enough that 1 in 10 patients will actually go and seek medical attention.
咁咧就10個呢個即係患者之中，其中一個咧可能要入呢個深切治療部嘅，即係。
So on the next slide, we don't know exactly what causes long COVID, but there are several theories. So the first is perhaps it's due to an abnormal autoimmune response, which means that the body is abnormally attacking its own organs.
咁至於呢個引起呢個所謂長新冠嘅原因咧，咁我哋都唔係好清楚嘅，但係咧有可能咧就係由於以下呢啲情況啦。第一咧就係可能佢嗰個患者本身嘅自身嗰個免疫系統咧，佢個反應 佢咧就係咧唔知點解咧，佢係會襲擊翻自己個身體嗰個組織嘅。
Some of the other theories are that one, there could be persistent virus that's still in the system, or it could be that there's ongoing inflammation in the body. And then the last theory that I have on this slide is that because COVID has been associated with blood clots, perhaps there's ongoing tiny blood clots happening throughout the body.
咁其他嘅即係原因咧，就可能嘅原因咧，就係包括埋佢可能持續性嘅嗰啲即係病毒啦，即係喺個身裏頭啦。另外咧就係一個比較長期啲嘅即係發炎嗰個情況，亦都會有咧就係好似我哋個呢個最後尾一行咧就係一個有血液裏頭咧一啲即係微型嘅一啲血凝塊啦。
So there's no specific test available to diagnose long COVID, and it's really based on people reporting ongoing symptoms and having a known history of COVID.
咁其實咧就話點樣可以確診到咧呢個長嘅新冠咧？其實冇一個即係特定或者指定嘅一個測試可以做得到嘅。大部分咧都係基於咧即係話即係嗰個患者咧。佢自己申報啦，即係表示佢有啲咩症狀啦，同埋你睇翻佢嗰個即係新冠肺炎嗰個病史嘅。
But it's also important to look for other possible causes of symptoms. So, for example, as a lung doctor, I often see people who have ongoing shortness of breath after COVID. And as part of the investigations, I've been able to identify that someone had asthma, for example, and that's what was causing the symptoms.
咁你好睇咧，就係話亦都係好重要，就係話即係醫生亦都會睇下排除或者個患者咧會唔會有其他嘅引起佢而家嘅呢個病徵嗰個原因咧？譬如好似嗰個即係如果肺嘅醫生咧，佢會睇下，咦嗰個患者咁嘅氣促會唔會係同佢係即係未有患呢個病之前，佢都會係有咁情況咧？就譬舉個例，就好似係譬如有哮喘。
So we did a study of 60 patients who were hospitalized for COVID within the Vancouver Coastal Health Authority.
咁我哋咧就有個研究咧，就係話咧喺呢個溫哥華沿岸衛生局嘅管轄下嘅醫院裏頭咧，因為呢個病入院嘅其中60位嘅病人啦。
And we followed them for 1 year, and they would come into our clinic, and we would see them at 3, 6, and 12 months. And they would complete surveys and different tests, such as breathing tests and CT scans.
咁我哋咧就係同呢啲病人咧，我哋跟進咗佢1年啦，係分別可能係由3個月至12個月期間啦。咁佢哋咧就係會嚟到我哋嘅診所咧，就係回答一啲問卷啦，亦都可能做一啲即係呼吸嘅測試啦，亦都可能做一啲又係 CT scan 電腦掃描咁樣啊。
So the table on the right-hand side, just on the previous slide, shows the profile of the patients that were in this study. They were in their late 60s on average. There were a little higher percentage of males, and their most common symptoms on presentation with their COVID illness was cough and shortness of breath.
咁喺我哋嘅即係圖表嘅右邊咧，我哋有個表咧，亦都列出咧就話即係喺年紀大概係即係65歲到啦嚇嗰類啦，或者係65歲後大少少啦。咁佢哋咧就係有啲即係男性啦，都有啲咁嘅類似嘅症狀，譬如就係有咳啊或者氣促啊嗰啲咁嘅情形。
And we could see that a significant proportion of people had underlying medical conditions, such as high blood pressure and diabetes.
咁呢類嘅病人咧，我哋發覺咧，佢原來咧，佢就可能咧，佢亦都會有其他嘅一啲嘅身體健康嘅問題啦，譬如好似係高血壓啦、糖尿病啊。
And then in the bottom section of this table, it describes their hospital course. And on average, people needed to be admitted to hospital for about 10 days. And usually this was because they required oxygen.
咁我哋圖表嘅下低嗰部分咧，亦都顯示到咧，究竟佢入醫院嗰個即係個情況係點樣咧？咁我哋睇到咧，平均嚟講咧，嗰個病人咧，一般咧都係喺醫院咧留醫咧大概10日到嘅。咁咧點解佢要留醫咁耐咧？咁好多時咧，佢係需要個氧氣咧，就輔助呢個呼吸嘅。
And 20% of the patients actually had such severe disease that they required intensive care support, so life support with a breathing machine.
咁大概有2成呢類嘅病人咧，佢哋係需要進入呢個即係深切治療部啦。咁同時咧，因為咧佢亦都可能咧就係需要一啲呼吸機，即係幫助佢嘅呼吸。
Okay, so then on the next slide,
咁我哋下一幅圖啦。
We see, so at 3 months, when they came in for their first visit, 20% reported ongoing shortness of breath and cough.
咁咧，佢哋咧就睇到咧，佢哋即係發病之後入咗醫院或者入到去診所咧，咁我哋嘅開頭3個月咧，我哋睇到咧佢都會係持續有呢個即係氣促啊同埋咳嗽嘅情況嘅。
And 58% of people had an abnormal breathing test. And the most common abnormality was the ability for the lungs to take oxygen from the environment and transfer it across the lung tissue into their bloodstream.
咁我哋都發覺有58%嘅病人咧，佢哋都係進行一啲所謂嘅可以呼吸嘅測試裏頭咧，咁佢哋咧就會係呼吸功能嘅測試裏頭咧，佢有唔正常嘅一個即係結果啦。咁呢個咧就係都有幾大程度上咧，就係最主要就係因為佢呢個吸呢個氧啦，同埋喺肺裏頭嘅咧，即係呢個更換個氣體入去呢個肺嘅組織，而進入我哋嘅血管嗰個能力啦。
On the next slide, we also did CT scans at 3 months.
咁我哋咧有啲病人咧就喺3個月之後咧，我哋同佢進行呢個電腦掃描 CT scan。
And we found that over half the patients, 55%, had signs of inflammation and scarring involving more than 10% of the lung volume.
咁我哋咧就發覺咧，有5成半嘅即係嘅病人咧，喺個電腦掃描之中咧，發覺佢咧就係又係有呢個發炎嘅現象啦，亦都有一啲即係結咗焦嘅組織啦，咁亦都係即係佔咗個肺嘅大概有1成咁多嘅。
So the right-hand figures show not a patient from our cohort, but this is very classic for what we would see post-COVID. So this is different slices through the lungs, and we see that the white material along the edges are scar material.
我哋睇到咧，呢個咧就係話即係後呢個即係新冠呢個肺炎之後嘅咧，就係睇到佢個肺嗰個情形嘅。你睇到右邊嗰個咧條白色嘅部分咧，其實就係有啲白點嗰個部分咧，就係一啲結咗焦嗰啲組織。
So this patient at day 32, we see the scar material, and then they re-imaged at day 198, and we see that the scar material is actually still present, although a little bit less.
咁就算過咗一段時間咧，就係咧，你睇到佢嗰個即係結咗焦嘅嗰個組織咧，雖然咧都係少咗啲嘅，但係仍然都仲係有喺度嘅。
Okay, the next slide. So then at 12 months, we repeated their breathing test both at 6 and 12 months.
咁10個月之後咧，我哋又重複翻呢啲咁嘅測試啦。
And what we found was that people's breathing tests actually improved by 6 months.
咁大概喺6個月度咧，我哋睇到咧，佢係嗰個呼吸嘅測試咧係有啲改善咗。
And then just the next slide. And then inflammation on the CT scan and the scarring, it did improve by about 12 months.
咁大概12個月度咧，我哋亦都睇得到咧，佢嗰個喺個電腦掃描裏頭咧，佢發炎啊，同埋嗰個即係結咗焦嗰個情況咧，亦都有所改善啦。
Next. But despite improvements in the lung function and the CT scan, people were still reporting difficulties with cough, shortness of breath, being tired, carrying out their daily activities, mood troubles, sleep and quality of life.
嗱，咁但係雖然話有咗改善喎，就係睇到佢即係話喺個即係肺功能啊，同埋 CT 對頭嚟睇到咧，佢嗰個患者咧仍然係有咳嗽啊，同埋呢個氣促啊、疲勞啊，或者影響日常生活啊，或者即係呢個即係走動嗰方面嘅影響啦，或者睡眠啊，甚至影響咗個生活質素添。
So in the bottom right-hand graph there, we see different symptoms over 3, 6, and 12 months. Those are represented by the different color bars. And we can see that the percentage of people who are reporting abnormalities stays quite high. It doesn't actually decrease very much over time.
咁你睇到右手邊一個圖表咧，呢個咧就顯示咗3至6個月嗰個即係症狀啦。咁有唔同顏色咧代表唔同嘅症狀啦。咁你亦都睇到咧，佢唔正常嗰個比例咧，百分比例都係冇乜點樣低嘅啊。
So on the next slide, so there's no specific treatment for long COVID, and the focus is really on decreasing the severity of symptoms.
咁其實咧，即係處理呢個長新冠呢樣嘢咧，咁係冇一個即係特定嘅一個治療嘅方式嘅。咁最主要嘅重點咧，都係咧，即係如何咧就減低嗰個即係病徵嗰個嚴重性嚴重嘅程度。
And then ensuring that other health conditions are treated. So making sure if you have high blood pressure, that's well controlled, or if you have diabetes, that your blood sugars are within a normal range.
咁亦都咧，同時咧要確保佢其他有嘅健康嘅問題咧，可以得到呢個適當嘅處理啦。譬如好似佢嘅血壓高啦，或者係呢個糖尿病啦。咁我希望咧就亦都係即係 keep 得佢個血壓就會係好啲、穩定啲啦，同埋係佢個血糖咧，亦都希望佢入翻一個正常嗰個範圍裏邊啦。
And there are some resources available, particularly in British Columbia. So there are post-COVID recovery clinics that specifically have physicians and other allied health team members to help patients.
咁咧，我哋喺其他嘅資源服務方面咧，卑詩省亦都有一啲咧，即係叫做後新冠肺炎嘅一啲復康嘅診所啦。亦都有啲其他一啲即係我哋一齊聯合嘅一齊做嘅一啲即係機構啦，有啲所有嘅資料嘅，可以喺呢度網上睇到嘅。
And locally there is a clinic at BGH.
咁我哋本地咧，亦都有一間咧，就係溫哥華中央醫院啦，全科醫院裏頭呢一間咧嘅呢個嘅診所，專門嘅診所。
And then I've just provided a link to a good resource. And it basically has information sheets that have been translated in different languages to help manage the various long COVID symptoms.
咁喺呢個銀幕嘅最底部分咧有個結連嘅，咁咧就係醫生咧就係將呢個結連咧就係可以咧如果有興趣嘅人咧就可以去上呢度啦，咁亦都會睇到咧一啲即係後嘅新冠肺炎嘅一啲復原嘅一啲嘅有關嘅資料同資訊。
Okay, so that's the section on outcomes after COVID, and we'll now move into discussing vaccination.
咁啱啱咧我就係講晒就係關於呢個即係患咗呢個所謂長新冠嘅一啲嘅後果係點樣樣啦。咁而家咧我跟住第二部分啦，就係講一講咧新冠肺炎嘅疫苗方面啦。
So before we go into the vaccination, we have to understand a little bit about the SARS-CoV-2 virus. So the original strain was identified in the late 2020.
咁咧，如果我哋未講呢個疫苗之前咧，我哋或者了解一下，即係呢個新冠嗰個病毒究竟係即係啲嗰個或者個原本嗰個即係品種係啲乜嘢咧？其實喺2020年尾咧，佢就係揾到出嚟嘅。
And as with all viruses, they are constantly changing and mutating, and this leads to variants from the original strain. So over time, since 2020, we've had different variants, such as the Alpha, the Delta, and currently Omicron is the most common variant for SARS-CoV-2.
咁咧就好似其他嘅過濾性病毒一樣啦，咁呢個新冠病毒咧，亦都會咧就不停咁咧就係變種嘅，由原本嘅最初嘅嗰個種咧，就一路係咁變咗係喺經過不斷嘅時間上咧，佢就變唔同嘅種啦，好似最初嘅由 Beta 啦，去到Alpha 啦，或者到而家都有Omicron啊咁樣嘅。
Okay, next slide. So this figure. Oh, sorry. So I'm just going to focus on the mRNA vaccines for the rest of the talk. because it's the most readily available. And so the mRNA vaccine initially targeted the original strain, but now we have a new bivalent mRNA vaccine that targets both the original strain and the Omicron strain, which is the most common in our environment.
咁咧就最初咧，我哋咧就係有個叫 MRNA 嗰個即係疫苗啦。咁呢個咧就係即係對付啦最初嗰個即係第一代啦，可能叫第一代嘅嗰個即係嗰個種啦。咁就後尾咧，我哋咧都咪咧係慢慢咧轉去到咧就係最近嘅咧個叫做2價疫苗啦。
Next slide. So this is a figure that shows how the mRNA vaccine works. So in number 1, the vaccine is made to target a specific protein on the COVID virus.
嗱，咁咧就第一種嗰個所謂嘅 mRNA 呢個咁嘅疫苗咧，佢最主要咧佢係有個即係好似係標靶咁一隻目標咧，係對付咧就係喺呢個新冠病毒嗰個表面嘅上高嘅一個即係蛋白。
It's then administered to a patient, and then it tells the human cells to make antibodies to the COVID virus.
咁呢個咧就係疫苗咧就打咗入個人體之後咧，佢就會即係好似話俾呢個人體裏頭講細胞講咧，就係話咧佢可以產生一啲所謂嘅抗體 antibody， 去攻擊翻嗰啲就係新冠嗰個病毒。
The mRNA material is then broken down by the body and does not stay within the system.
咁嗰個 mRNA 嗰啲疫苗咧，咁佢打咗入身體之後咧，佢會自己分解嘅，咁咧佢就唔會話即係平留喺我哋身體裏邊嘅。
And then when someone's exposed to the COVID virus, they already know that, oh, this should not be in my system, and we're going to use those antibodies and kill that virus.
咁一旦咧，即係如果嗰個人佢即係暴露咗喺一啲新冠病毒裏邊咧，即係患到呢啲咁嘅新冠病毒咧，咁佢嘅身體內嘅嗰啲疫苗咧，亦都免疫系統亦都會話俾個身體聽咧，呢啲咧就唔係我哋嘅身體個系統裏頭嘅一部分嚟嘅，咁我哋就會攻擊佢啦。
So next slide. So there's some common scenarios that are often raised. So the first is, well, should I get the vaccination or not?
咁有好多嘅即係版本咧，喺呢方面咧就會有人會提出疑問啦，就係話，喂，究竟我需唔需要打呢啲咁嘅疫苗㗎？
So this study looked at people who received the mRNA vaccine, either the Pfizer or the Moderna, and they compared the rates of emergency room visits or hospitalization for COVID to those who did not receive the vaccine.
咁你睇到咧，就係話當嗰啲即係人咧打咗呢個輝瑞啊，或者係莫德納咧呢啲咁嘅 mRNA 嘅疫苗之後咧，佢要入呢個急症室同埋住院嗰個即係比例咧，嗰個係比一啲冇打嘅咧係為低嘅。
So in the top panel, it looks at the effectiveness of preventing emergency room visits for COVID. And we see that people who received the vaccine, between 89 to 92%, had a lower chance of needing to go to emergency room compared to people who did not get the vaccine.
咁我哋睇個圖表嗰度，亦都表示到咧，就係話咧，打咗針嗰啲人咧，佢係有即係8%至92%嘅百分比咧，係可以避免咧去進入呢個即係所謂嘅醫院急症室或者係住院啦。
And then in the lower panel, it looks at the rate of hospitalization for COVID, so being sick enough to be admitted to hospital. And again, people who were vaccinated, between 87 to 91%, had a lower chance of needing hospitalization compared to people who did not have the vaccination.
咁亦都同時咧，就係因為好嚴重嘅即係呢個病徵咧，而需要入院去即係治療嘅咧，佢嗰個即係所謂疫苗嘅有效率咧，亦都係比冇打嘅咧，就係咧佢高出咗咧，就係佢有87%至91%嘅。
And so the summary is that the COVID vaccine, the mRNA ones shown here, are highly effective against severe COVID infection, needing less hospitalization, less admission to intensive care, and then less emergency room visits.
咁就可以喺個研究嗰度睇到啦。如果打咗疫苗咧，就係要引發咗即係比較嚴重嘅呢個病狀症狀啊，或者要入呢個醫院啊，轉入呢個深切治療部啊，或者係呢個急症嘅咧，亦都係比較係少好多嘅。
So the next slide, well, what about the boosters? So this study was conducted in Israel, and it specifically looked at different doses of the Pfizer-BioNTech vaccine.
咁我哋跟住睇下一張圖片咧，就係話咧呢個係根據就以色列嗰邊嘅研究啦。咁我哋係咪需要打加強劑咧？咁我哋咧就睇到咧，如果打咗即係唔同嘅即係劑量咧，唔同打咗幾劑咧，嗰啲嘅所謂嘅呢個 BioNTech 啦，呢個復必泰咧。嗰個嚟比較咧
So they had just over 6,100 participants, and if we look at the figure on the right-hand side, the orange line shows people who had 2 doses, the blue line 3 doses, and the purple line 4 doses.
嗱，咁喺個圖表嗰度咧，你睇得到咧，就大概有6100人到啦，就係參與啦。咁咧，你睇到咧就係打咗2劑嘅咧，就係橙色線嗰度顯示啦。藍色線顯示咧就打咗3劑，而呢個就係紫色線嘅咧就係打咗4劑嘅。
And the graph shows the level of antibodies over time.
咁圖表亦都顯示到咧，就係唔同時間咧嗰個人嘅裏頭個抗體嗰個水平咧，去到邊一度？
So we see that people who received 3 or 4 doses had higher antibody levels compared to those who only had two doses.
咁我哋睇到咧，就係如果嗰啲人咧打咗3劑或者4劑嘅咧，佢體內嗰個咧抗體嗰個水平咧，係比打2劑嘅咧嗰啲人士咧係高啲嘅。
And we also noticed that the peak of antibody production is around 4 weeks from the time of administration.
咁亦同時有一個圖我哋都睇到咧，就係話咧，你打咗針嘅大概4個禮拜度咧，咁咧嗰個人體裏頭嘅抗體個水平咧，就會係達到係頂峰點噶啦。
So when you look at the 3rd and the 4th dose, you could say, well, they're producing about the same amount of antibodies. Do I need that 4th dose?
咁你又會問啦，咁如果打咗我睇到個圖咧，打咗3針同打咗4針咧，其實嗰個抗體嘅水平都差唔多嘅啫喎，咁點解我仲要打第4針咧
？So in the next slide, this was a study that looked specifically at 3 versus 4 doses.
咁跟住我哋就睇一睇呢個圖表啦。呢個研究咧就係咧針對咧就打咗3針同打咗4針嘅人。
And what they found was that the rate of COVID infection was similar between the 2 groups, but those who had only 3 doses had a higher risk of having severe illness compared to those who had 4 doses.
咁我哋睇到咧就係個圖表就係話咧打咗3針同打咗4針而感染呢個即係新冠肺炎呢個人士嘅數目咧都係差唔多嘅啫。咁但係有一樣咧想提一提咧就係話咧，原來打咗3針得到即係比較嚴重嘅嗰個症狀嘅嗰類人士咧，係比打咗4針嘅係為高嘅，即係個風險率係高咗嘅。
Okay, and then on the next slide, we've got the last scenario is, well, what if I've already been infected with COVID and do I have sufficient natural immunity to prevent reinfection?
咁最後一步咧，亦都講一講就如果我哋打咗針之後咧，如果係係惹到呢個即係新冠呢個病毒嘅時候咧，咁我哋係咪睇落嗰個天然嗰個即係免疫能力都會係即係點樣反應啊？會唔會高咗啲㗎？
So this study looked at people who had previous infection and the risk of having reinfection in the future. And they split the group into people who were infected before the Omicron wave and then during the Omicron wave.
咁我哋呢度咧分開兩部分，一部分咧就係話即係睇到佢之前嘅嘢，即係已經中咗招啦。咁啊之後咧，將來咧佢嗰個中招嘅機會率啊，同埋嗰個情況係點樣嘅啊？
So people who were infected with COVID before the Omicron wave, the time from their initial infection to reinfection was about 518 days or a year and a half. And what they found was that there was only 35% effectiveness at preventing future infection.
咁你都睇到咧，就係初期如果係中咗招之後咧，大概有580日度咧，佢如果呢一類咁亦都有機呢類人士咧，亦都有機會係再中嘅，再中呢個即係新冠呢個病呢個肺炎。咁亦都係咧，亦都睇到有30%咧係有效嘅，有效率。
And then those who were infected during the Omicron wave, so the time from infection to reinfection was about 6 months, and there was a 76% effectiveness at preventing reinfection.
咁咧就係喺中咗呢個即係 Omicron 嗰個方面咧，如果係之前中過咧，佢亦都係有6個月嘅時間，亦都有機會係中到啦。呢個疫苗嘅有效率咧，亦都有60%幾嘅。
So the summary is that COVID infection, it does offer some protection, but the strength of that protection, it depends on what strain you were infected with, and then that strength of protection also decreases with time.
咁我哋亦都係研究亦都顯示咧，就話即係中疫苗咧，係的而且確係對呢個即係感染咧係有一個即係保護作用嘅。但係亦都係要視乎咧，就係打係即係中邊一隻啦，邊一隻亦都可能咧就係咧就會亦都係會有呢個保護作用嘅，但係個程度係唔同嘅。
Next slide. So COVID vaccination is safe and reliable, and it's a safe and reliable way to build protection against severe COVID. It creates an antibody response, importantly, without having to experience potentially severe illness or long COVID.
咁咧就新冠肺炎呢個疫苗咧係安全同埋可靠嘅，亦都係即係可以幫助我哋身體咧，就係咧建立一個即係對呢個嚴重嘅新冠病肺炎嘅一個保障嘅。咁亦都係可以咧，就係幫我哋咧就令我哋身體咧產生一啲抗體嘅即係嘅作用咧反應啦。係可以避免咧就係有一啲嚴重嘅即係疾病或者係即係所謂惹到嗰啲叫做長新冠呢個可能性啦。
And then people who do get COVID, there is some immunity, but that level and protection wanes with time. And especially as new variants emerge, it's an important consideration.
咁但係人如果係亦都會係一啲所謂一啲嘅免疫能力啦，就如果佢惹到呢個即係呢個中咗招啦，咁但係咧而呢個嗰個程度啊，或者嗰個保護嘅能力咧，係視乎咧佢係睇佢中咗係邊一隻嘅邊隻種啦，咁而咧即係佢個時間咧就唔係一樣嘅。
So to summarize on the next slide, the goal really is to avoid severe illness.
咁我哋嘅目標咧，仍然咧即係最主要即係預防咧，就係有嚴重嘅一啲即係病徵啦，嗰個毛病啦嚇。
And that will allow us to minimize the chance of short and long-term complications related to COVID.
亦都係盡量減少咧，就係話有即係長期一啲受嘅即係影響啦，同埋有啲受嘅併發症啦。
And the way to do this is to manage your health conditions, be as physically active as possible, and keeping up to date with vaccinations.
咁你會問點樣做啊？咁就係咧，首先咧你要管理好自己健康個情況啦。第二咧就係要保持活躍啦，即係繼續做一啲運動啦。咁第三咧就係要接種咧最新嘅新冠肺炎嘅疫苗啦。
Great, so thank you for your attention.